Just for our final presenter, we're going to move forward with an introduction of Zakiba Henderson, who leads the Office of Maternal and Child Health Impact at March of Dimes.
Good morning. I'm so excited to join you all this morning. And so today, as part of this discussion on state efforts to redesign maternal health care, I'm going to focus my discussion on state perinatal quality collaboratives. While we're waiting for the slides, I just wanted to say that we heard a lot yesterday about some of the data behind what's happening in maternal morbidity and mortality. We heard about, we're hearing about different solutions and realizing and recognizing that it's a multifaceted and multifactorial problem. And because it's a multifactorial problem, there are going to be multifaceted solutions. And I'd like to focus on the improving care and outcomes for moms and babies through state perinatal quality collaboratives. Next slide, please. So we talked about this data, and substantial components of various measures of maternal and infant health are very much influenced by decisions made in healthcare facilities and by healthcare providers. And there was a lot of discussion, some discussion yesterday around the time that a patient enters the healthcare system is just an episode in their full spectrum of their life course. However, this one episode, this spot in time is one that impacts outcomes of mothers and their infants so profoundly. And collectively, the decisions that comprise our healthcare delivery systems and the decisions that they make in providing care impact the outcomes of care. And there's definitely room for improvement in the quality of care provided by these systems. Next slide, please. So in the Institute of Medicine Crossing the Quality Chasm report, it's been about 20 years ago that this report came out ago. Quality is defined as a degree to which health services for individuals and populations to increase the likelihood of desired health outcomes and are consistent with current professional knowledge. This report describes the following characteristics of quality: safety, avoiding injuries to patients from the care that is intended to help them, effectiveness, in providing services based on scientific knowledge to all who could benefit and refraining from providing services to those not likely to benefit. Third, patient-centeredness, providing care that is respectful of and responsive to individual patient preferences, needs, and values, and ensuring that patient values guide all clinical decisions. Fourth, timeliness, reducing wait times and sometimes harmful delays for both those who receive and those who give care. Having care that is efficient, which includes avoiding waste, including waste of equipment, supplies, ideas, and energy. And then last but surely not least is equity, providing care that does not vary in quality because of personal characteristics such as gender, ethnicity, geographic location, and socioeconomic status. I think it's important to note that even 20 years ago, equity was called out as a key component of quality care, and that the ultimate goal of providing high quality, equitable care is to improve and close disparity gaps. Next slide, please. So growing research suggests that hospital quality may be a critical lever for improving outcomes and narrowing disparities. We acknowledge that the hospital encounter is just one episode during the life course, but about 60% of maternal mortality and severe events are preventable, and hospital quality is a significant lever. One of the people that really drives my interest and passion around this work and is a constant reminder, I'm sure you're familiar with the story of Kira Johnson. And we talk about maternal mortality, and her story is often presented. And the circumstances around her death were centered around that hospital episode. And sadly, data have demonstrated that both within hospital and between hospital disparities exist for severe maternal morbidity. White and Black women may deliver in separate hospitals, and hospitals primarily serving Black patients may have structural characteristics associated with lower quality or have organizational models or clinical processes that lead to lower quality of care. And secondly, the quality of care received by patients during childbirth may differ by race, even within the same hospital. Next slide. So as a solution to addressing some of these issues of quality that is provided in hospital and also in other care settings, perinatal quality collaboratives have been working in states to specifically improve the quality of care provided to mothers and their infants. PQCs are state or multi-state networks of multidisciplinary teams that improve measurable outcomes for maternal and infant health by advancing evidence-informed clinical practices and processes using quality improvement principles. Perinatal quality collaboratives address gaps by working with teams in the clinical setting, various experts throughout the state, and stakeholders, including patients and families, to spread best practices, to reduce variation in care, and by optimizing resources to improve perinatal care and outcomes. Next slide. Sometimes it's hard for people to wrap their brains around how do these networks work. Sometimes you hear about PQCs and you think about bundles, you think about data, you may think about people coming together. But the main functions of state PQCs can be distilled down to three main strategies, also known as the three PQC pillars. And that includes collaborative learning, rapid response data, and quality improvement science support. The collaborative learning model includes the use of sharing and teams working together to share strategies, solutions, and using evidence-based methods to reach a common objective. The use of rapid response data is helpful for feedback to teams and helping them to have continued progress toward meeting quality improvement objectives by telling them where they are along the continuum of reaching that objective. And then providing quality improvement science support and assistance to clinical teams is a key component of PQC work. The ultimate goal of PQC is to achieve improvements in population level outcomes in maternal and infant health. Next slide, please. So many organizations, hospitals, hospital systems may take on various quality improvement initiatives and projects, but PQCs have a unique role in that they encourage taking on the responsibility of improving outcomes for the entire population of the region's mothers and infants. They understand the regional network of perinatal care, can collaborate among teams from both the hospital and in the community, and can compare the performance of hospitals that are operating within a similar demographic, economic, and health services context. Members of a regional quality improvement initiative represent a community of change working together toward a common objective. Next slide, please. I often describe the ways that PQCs work as the power of PQCs. So PQCs play an essential role in understanding what is happening with clinical care for mothers and newborns on the ground at the patient and provider level, and able to make change at that level, in addition to having the ability to scale up improvements statewide through the collective efforts of delivery and centers and NICUs across the state. PQCs also foster hospital-level leadership and ownership of efforts and bring together multiple partners and stakeholders to work toward a common objective to change outcomes and culture of care. The culture of care, that is a key component. It's one thing to change behaviors. It's a whole other thing to change culture. Next slide. I love to show some of the pictures of how PQCs work and are in action, because it really takes, and I love the way Dr. Menard put it, that local change happens locally, and that it's the collective change that happens at the local level that can collectively lead to change over the state and ultimately across the country. PQCs work without a lot of resources, many of them with volunteer effort, engaging champions within the hospital to work to improve care for their patients, being able to pull teams across hospitals, including hospitals that compete against each other, to work toward the same objective, improving measurable outcomes. The other key component that's so important is having that patient voice and patient involvement. And patients are a key component to contributing to the efforts of improving efforts through PQCs. Next slide, please. Next. So in talking about some of the PQC successes, over the past decade, there have been documentation of PQC successes in the literature, including reductions in elective deliveries without a medical indication prior to 39 weeks gestation. Some of the first efforts centered around early elective delivery. Next. Just click one more time, please. In addition to these efforts, there have been efforts around neonatal care in the NICU and successes around preventing infection. Next. Other efforts including reducing maternal morbidity and mortality, such as reductions in severe morbidity from obstetric hemorrhage. Next. Click, please. Efforts around breastfeeding. Click, please. There's a delay with the click. Efforts around improving timely treatment for obstetric hypertension. And one more click, please. And most recently, evidence around improving interventions to reduce unnecessary cesarean deliveries. Next slide, please. So in thinking about the work of state perinatal quality collaboratives, a lot of progress has been made over the past decade. The number of PQCs in the country has grown considerably, with every state now in the country having a PQC either currently working in the state or one in development, as you can see by the many states that are colored in various shades of green to blue on this map. This map has changed a lot over the past decade, though, and there's been a lot of momentum. And I would note that a lot of this momentum has happened outside of having the funding and support to fully support this work, because people are passionate about improving outcomes. They want to provide better care. They want to receive the data and feedback and be able to work together to have improvements. But the one thing to note that even though almost all of these states pretty much every state in the country has a PQC, a lot of these states have very new collaboratives that are just getting started. And although most states have an identified PQC organization, most of them lack the resources to be fully functional and have yet to reach their maximum potential to make measurable improvements in statewide maternal and infant health outcomes and health care. I'm so excited about this work, but I often hear, people say, well, PQCs haven't quite done it. They haven't crossed the finish line. They haven't. And I think that there is more work to be done to help bring more states to the level where they're able to publish those results, where they're able to see measurable results, and ultimately able to close the disparity gaps that are seen in states. Next slide, please. Next slide, please. So one of the ways that state perinatal quality collaboratives are being supported is through the National Network of Perinatal Quality Collaboratives, which is funded by the Centers for Disease Control and Prevention and is coordinated by NICHQ, which is the National Institute for Children's Health Quality. And the mission of this network is to support the development and enhance the ability of state perinatal quality collaboratives to make measurable improvements in statewide maternal and infant health care and health outcomes. It is through this network that states are able to share resources, to not recreate the wheel, to be able to share successes and strategies, and also to provide technical assistance to newer states to become fully functional state collaboratives. Next slide, please. So then we get to the elephant in the room, the main question, and I'm going to end with this. What about PQCs and equitable maternity care? What are PQCs doing and what can they do? And I think this is an area where there's an opportunity for more growth and more success. And I'd just like to shine a light on a few examples that have been successful and that are continuing to influence the work that other PQCs are doing. Next slide. So the first state PQC I'd like to highlight is the Louisiana Perinatal Quality Collaborative. So even on its webpage, you can go there and take a look at what their mission and what their strategies are. And right up front, they're very clear in their mission and their vision statements about the importance of equity Click one more time, please. As part of this work, they are very clear that their main objectives are for births to be safe, for them to be equitable, and for them to be dignified. And this is reflected in their communications. This is reflected in how they collect data, making sure data is stratified and disaggregated to the point where you can see how different populations are impacted by improvement efforts. Other states have been trying to follow in that example. Click again. And are including, can you click one more time, please? Are including issues around equity in their mission statements. And in addition to that, click again, are directing specific efforts toward initiatives specifically targeting disparities and improving outcomes for women that have the worst outcomes. Next, click again. Thank you. So there are lots of opportunities, and as these states are building the evidence base and testing strategies, more states through this network can learn from them and various partners that are engaged in these efforts to directly address the issues around respectful care, issues around disparities and outcomes for maternal mortality and morbidity. Next slide, please. I also would like to share on how various partners are working with PQCs. March of Dimes entered into a public-private partnership with the Department of Health and Human Services in November of 2020 to improve maternal health outcomes and to advance racial equity. And the key activity of this partnership is a quality improvement pilot focused on reducing the Black-white disparity gap in outcomes during the birth hospitalization. A stakeholder group of over 36 Black maternal health experts and advocates was convened in March 19th of this year to provide guidance on design of a quality improvement pilot. And thanks to this amazing stakeholder group, which includes many on this call, a multimodal QI pilot funded by United Healthcare that incorporates supporting vaginal birth, community accountability, and respectful care is set to roll out at the end of this year. It is the goal of this project to work directly with state perinatal quality collaboratives with a goal of strengthening both their reach and sustainability and their involvement in improving equity. Next slide, please. So the goal, next slide, please. So the goal of improving maternal health requires that many players come together to contribute to the success of projects and initiatives that can improve state outcomes, as well as have the potential to collectively lead to national change. I think it's important, if we don't realize anything from the diverse speakers that have come up during this workshop, is that no one sector, no one group can do it alone. Partnerships, open collaboration, and sharing are central to what makes the PQC model so successful, and I think will be the key to making this effort to move the needle for maternal health. There are many opportunities for expanding this work, and I hope that by facilitating these types of partnerships and really advocating to support these networks and states to help to have the infrastructure and the capacity to lead to improvements in perinatal care and outcomes. Next slide. Next slide. I'd just like to thank and acknowledge all of the state PQCs across the country. I'm excited to hear from some of the leaders from PQCs that will be speaking today during this workshop. Thank you so much.